High Point Medical Center has a deep, rich history in this community, beginning in 1904, more than 116 years ago. As the organization has grown over time, our community has supported and embraced our efforts to offer high-quality healthcare services for the people of this region. This support has never been more evident than over the last few years as we launched the Capital Campaign for High Point Medical Center. Between the Capital Campaign and our merger with Wake Forest Baptist Health, much change has occurred in the recent years. But our commitment to providing highly personalized, compassionate care for High Point has not wavered. In 1985, we built a healthcare facility that was appropriate for the needs of that era. In the 35 years since, the world has certainly changed, but nowhere has that change been more dramatic and apparent than in medicine. Thanks to the generous support of this community, $33 million has been donated to help fund future forward improvements in the areas of cardiology, oncology, and surgery to meet the emerging needs of our patients. Thanks to your support, we have armed our outstanding healthcare providers with the best tools available so they can provide the highest level of care for our patients. With the support of the Capital Campaign, High Point Medical Center has completely renovated the third floor of the hospital and enhanced our operating suites, our Congdon Heart and Vascular Center, and we've made critical improvements to the Hayworth Cancer Center. No one wants to be told that they have to have a surgical procedure, any surgical procedure, from joint replacement to a hernia repair to complex heart and pulmonary surgeries that can all cause a level of anxiety for patients and their families. But knowing that High Point Medical Center has expert surgeons matched with state-of-the-art operating rooms and the latest surgical software and technology means you can rest assured you will receive the very best, highly personalized care right here in High Point.
My name is Dr. Nikhil Tapar. I'm one of the laparoscopic and robotic bariatric surgeons at High Point Medical Center. Robotic surgery is essentially advanced laparoscopic surgery. I make small incisions in the abdominal wall, and we place robotic ports, but then I go to a console right next to the patient, making very fine movements, essentially microdissection. Robotics is beneficial because we can essentially perform traditionally open operations into a minimally invasive procedure. So with all the procedure being done internally, this leads to less tissue trauma, less bleeding, and ultimately faster return to normal functions. We're really excited because recently Intuitive announced that we will be an epicenter for general surgery. What that means is surgeons and surgical teams will come to observe us in the operating room and how we do operations and watch kind of how we operate, both myself and the team. This will be the first epicenter in North Carolina. Having the Da Vinci Xi, via the generosity of the Capital Campaign donors, we've allowed thoracic surgery to grow the program here in High Point and allow traditionally open procedures to be performed in a minimally invasive approach and allow these patients to stay in High Point for their care. To the Capital Campaign donors, I want to say a sincere thank you for everything you've done in keeping us on the cutting edge of surgical technology.
As heart disease becomes more prevalent and our population ages, demand for advanced techniques in minimally invasive procedures and the ability to handle more complex procedures has dramatically increased. Thanks to the Capital Campaign, we've made many advances in heart and vascular care right here in High Point.
My name is Barry Cheek. I'm an interventional cardiologist at High Point Medical Center, and I've been practicing here for a little over 30 years. High Point Medical Center has been a very well-supported medical institution for many years. And the campaign has made possible renovations and actually the construction of a new heart wing, including new cardiac catheterization labs and electrophysiology labs, a hybrid operating room labs where we can all perform a variety of procedures, new operating rooms for our cardiac surgeons. Honestly, now our facilities are second to none in the Triad. Having all of our cardiovascular services consolidated in one location, one physical location, is very important. Obviously, it's more convenient for the providers, for us, the nursing staff, and also we can have specially trained nursing staff and support staff that are there that focus only on our patients and what we do. So from a patient satisfaction standpoint and ease of use, it's ideal for our patients. The next frontier for our heart program is the performance of structural heart procedures. And these will be performed in the cardiovascular OR, which was made possible by the generosity and the donation for the capital campaign. These procedures are a collaboration between cardiac surgeons and interventional cardiologists. And these procedures are ideally performed in a large, well-equipped, well-staffed cardiovascular OR, and now we have that. To everyone involved with the capital campaign, on behalf of my partners and I and the whole staff in the cardiovascular program, we'd like to say thank you very much. Without your generosity, we would not be where we are today and where we will be in the future.
The Hayworth Cancer Center has also benefited greatly from the capital campaign. Thanks to your support, we have updated the Hayworth Cancer Center with the latest in detection, treatment, and recovery technology. We have also established a new surgical oncology clinic, bringing together specialty trained surgeons in breast, gynecology, and lung cancer. This new clinic allows not only for many oncology surgeries to be performed right here in High Point, but regular follow-up visits with a surgeon can also take place here as well.
My name is Jody Dixon, and I am the Service Line Director for Oncology at Hayworth Cancer Center. I've been at High Point for 25 years, and I have worked in the intensive care. I have worked on the 6th floor. I've taken care of many units, and most recently I became the Director of the Oncology Service Line. Hayworth is a wonderful place. It's I think it's a state-of-the-art, but it's yet small enough that when patients come in, we know their name, and it becomes like a family environment. We've got services for medical oncology, radiation oncology, and now we have our specialty clinics, but we also offer an urgent care that is for oncology patients. We have the Hayworth Oncology Pharmacy, and that is located on the same floor with the infusion center. That has been a wonderful addition so that we can prepare the chemotherapy there on site. We had been working very hard over the previous 6 months trying to get all the departments open for the different clinics. And little did I know that I would be the recipient of the services that we were getting prepared for. Bill is he's ran a construction business his whole life. Wouldn't have it any other way. He likes hard work. He loves the kids. He loves his grandkids. We have 2 grandkids that are really, really special. So he really enjoys spending time with them, taking them fishing. He had had this pneumonia for quite some time, and we tried treating it with traditional therapies, antibiotics, and he wasn't getting any better. So we continued to try to work with that until finally one evening, his breathing got so bad that I brought him into the emergency department. They ran some tests and realized that he had a lung mass. I remember that my husband and I were sitting in the room, and we didn't even have words to say. We just looked at each other as we were trying to figure out what we were going to do and how we would tell our kids. And how do you go on with your life whenever you don't know what the outcomes? It's that feeling of uncertainty. And it was at that point that the team of physicians and nurses began to rally around us, and we felt the support of the hospital. We did find out that it was not cancer, but that it was a mass in his lung that needed to be removed. So we talked about moving him over to Wake Forest to have the robotic surgery. I didn't want to move him to Wake Forest. I wanted him to be here. I wanted him to be with our family and with where our physicians were. And we thought we didn't have a choice until the morning that he had spent a really rough night. And then in the morning, Dr. Ferguson walked in, and Dr. Ferguson was just starting at High Point, and I knew Dr. Ferguson was coming to High Point because I've been preparing for him as I was working in my job. But at this point, I was a family member, and that was my husband that was laying there having a really hard time breathing. And he said, we need to get him to surgery today. And so we went to surgery. 3.5 hours later, he came out of the OR, and they were as successfully able to take the mass out. We had a long recovery, and I cannot say enough about the care that we received while we were there. I've always known that High Point it's a great hospital, and being on the side of being the wife of a patient, I realize that we have a huge impact. And I just would like to say thank you to the donors and the people who reach down in their pocket and make it possible, that participate and partner with us so that the services that we provide get stronger each year. My mom used to say that ease does not come with success, that success requires a lot of hard work, and we've got a lot of work ahead of us. We've got a lot of growth to work toward, and we need to bring on new services and new technology as we plan to take care of our patients. And I believe that we have the partnership with our community that will embrace that and work with us together as we continue to grow and take care of the patient, because that's what it's all about, is taking care of the patient.
There are few relationships as important as the one between a hospital and its community. It's a bond interwoven through generations, from the celebration of birth through the various experiences of bones mended, fevers tamed, infections overcome, and diseases cured. When life for one generation ends, we can hear the cries from the labor and delivery that announces that life anew is beginning once more. We are so grateful for the amazing generosity of this community and the very special people we have within our organization, dedicated to care for all who come to us in need. On behalf of the Board of Directors, our medical providers, staff, and volunteers, thank you for trusting us as your healthcare provider and for trusting us to care for this community for more than a century.